experience of more than 30,000 patients with advanced cancer diagnoses. And we saw that before the Affordable Care Act, there were racial disparities in the time to cancer treatment, that white patients were getting treated sooner than black patients. And after Medicaid expansion, where almost half of states, well, more than half of states chose to adopt Medicaid expansion while the others didn't. But states that expanded Medicaid, racial disparities between black and white patients were practically eliminated. And in states that didn't expand Medicaid, the racial disparities persist to this day.
We used the large data set, and it's not what's typically called a randomized trial, where patients are being randomly assigned to one treatment arm or the non-treatment arm. In this case, patients live where they live and they're diagnosed with cancer at different times, and so we observed whether they initiated treatment in a timely fashion based on whether the state where they lived had expanded Medicaid at that time. So we did that by using this large data set and then linking information on the diagnosis state to the state policy in place as of the time of that diagnosis. And then we sort of used what's called regression analysis, and we tested our hypothesis using statistical methods. And in that analysis, we also controlled for other characteristics of the patients that might have affected timely treatment, what kind of cancer they had, and whether they were in a community or academic practice setting, and then also some other statistical controls to help strengthen the study design. So prior to Medicaid expansion in states that had not expanded, we found significant disparities in the proportion of patients receiving timely treatment of this within 30 days after diagnosis. Black patients were almost 5 percentage points less likely to be getting timely treatment. And then once states expanded Medicaid, a patient diagnosed in a state that had expanded Medicaid, there were almost basically the difference or disparity in timely treatment was eliminated.
There's really a lot of potential to use electronic health records now for this type of real-time policy evaluation. Before, we've seen researchers only having access to data that is many years lagging behind, and so it's not really useful to inform current policy design. And in this study, we learned from patients all the way through February 28, 2019. And I think that we can use this to inform new policy design and think about what the counterfactual would be if the Affordable Care Act and Medicaid expansion hadn't happened. Then we might still see racial disparities to this day in the states that had expanded.
I think the study results do focus on a large population, and we think it's a rigorous design, but it is a very specific question that we asked. We asked about timely initiation of treatment for a certain group of patients diagnosed with advanced or metastatic cancers. We would like to be able to use the data set or have other studies sort of expand on this. But in terms of informing policy, this is one small, well-documented example. And I think we will undoubtedly need more evidence to support the role of the Affordable Care Act on disparities in care, to at least get the attention of policymakers going forward. But I think it's certainly an important first step, and we'd like to see more work done in this area.